Well, the Cleveland Clinic brought together national leaders in healthcare research and advocacy for its first inaugural Women's Health Forum last week. It was all to honor the one-year anniversary of the Women's Comprehensive Health and Research Center. The center's chief visionary and strategic advisor is none other than Maria Shriver. 3 News health anchor Monica Robbins got the chance to talk with her one-on-one about several topics concerning women's health.
It has been a year. Welcome back. The Cleveland Clinic Women's Health Center has served 10,000 patients. They cut menopause wait times from months to weeks. That's huge. What's your vision where women's health care needs to go next? And what's the one thing you want women to understand about advocating for their own health?
Well, I want women to know that it's imperative that they advocate for their own health because no one else is going to do it for them. I want women to know that they should trust their own inner voice. If they are feeling something and being told it's all in your head, to find a different doctor. And to come to the Cleveland Clinic because we're putting a flag in the ground and saying we want to be the preeminent health and research center for women in the world. We want to be able to deliver the best care at every decade of your life because women's health changes at every decade. Women in their 20s and 30s are dealing with very different issues than women in their 60s and 70s and 50s and 40s. And we're trying to look at women comprehensively and holistically. And it has shown here that there is a huge need. The numbers are overwhelming, and so the sky is the limit to what can be built here and done here and cared for here.
How frustrating is it for you? Because I hear these stories all the time where women will go see a doctor, they're not sure about these symptoms, yet they're dismissed. Right. But they're so busy, they don't have time to go see another doctor. Right. What do you want to say to them?
I want to say that you matter and that the most important person to matter to is yourself. And the most important person to pay attention to is yourself. And that's not selfish. That's critical if you want to live independently and healthy. And when I talk about women's health, I mean their cognitive health, their spiritual health, their emotional health, and their physical health, and their financial health. It's a comprehensive bucket. And if you're dismissed, if you're not validated, if you're not feeling seen or heard, you can't feel good about yourself and you will get sick, and then all the dominoes that depend on you won't be able to survive. So if a woman cares for herself, the rest of the home is cared for. If she puts herself at the bottom, which I think has been the tradition for generations, everything goes askew. So I think honoring your symptoms, honoring yourself, honoring your health is the best thing that you can do.
With this center, the Women's Alzheimer's Movement, research is a huge passion of yours. Now with this $1.5 million grant to get that going, what do you want to see that research do?
Well, we are decades and decades behind when it comes to women's health research. That's why I partnered with the Bidens to launch the White House Initiative on Women's Health and Research, because we don't have the research to answer the question that women have when they go to the doctors. The medicine hasn't been tested on women. Dosages haven't been tested on women. Women don't know how to age forward because we don't have the research. And so we deserve better. That's why research is a critical component of this. The Women's Alzheimer's Movement has led the way in women's research in Alzheimer's. And we've changed the trajectory for women there. We're now able to look at women's brains and tell women, you feel this way at menopause because we can now see what happens to your brain at menopause. We deserve the latest and the best research by the best and the brightest. And that's why I wanted to come here and build a center of the best and the brightest for the best and the brightest who are the women of the world.
Well, what's still so frightening is that 2/3 of Alzheimer's patients are women.
Yeah.
After the pandemic, we keep hearing that Alzheimer's rates are going to skyrocket, mainly affecting women. All the brain fog cases were more so affecting women with long COVID. Where do we go from here? What do you want to see, and especially with the Women's Alzheimer's Movement, research into that?
Well, the numbers of Alzheimer's are growing, right, because we're an aging nation. And even though America prizes youth, we're an aging nation. So more people are going to get Alzheimer's and other forms of dementia and other neurological diseases. We're going to need more caregivers in this country. So funding research into women's brains is an important part of the Women's Alzheimer's movement, which is here at the Women's Comprehensive Health Center. I would say to families, you need to get your affairs in order. If you have someone with Alzheimer's in your family, you have to have family discussions about who's going to be doing the care for that family member, and coming together in whatever way you can. So I think Alzheimer's is a huge national issue. We need to vote for people who prioritize issues that affect women, that affect families. We need to recognize that research is a political issue, not just a medical issue. And we need to just keep our foot on the gas pedal. I don't get, I think, you know, it's maddening that women are where they are today, but I don't kind of look at the past. I want to look at the future. And so for me, that just exemplifies why the need for this center, that combines care and research. And this can be a global center and should be in every location where the Cleveland Clinic is globally, and should be a national center, because women from all over the country need this kind of care.
You're not wrong about everything becoming political, but how concerned are you about all the funding that's being cut toward scientific research?
I just keep my head down, and I keep my focus focused, and that's on funding Alzheimer's research, women's health research, and I just keep using my voice in a way that makes sense to me, and I don't get intimidated by the noise of the day.
This past month at the Lou Ruvo Center, you talked about Alzheimer's, menopause, and longevity among women. Was there anything in that discussion that surprised you?
No, because I kind of am in this every day. And what maybe surprises me, not at that, but kind of generally, is how few women still are aware that there's something that they can do to perhaps prevent Alzheimer's or other dementias, that they are unaware that there are things they can do to strengthen their brain health, that they're still unaware that Alzheimer's disproportionately impacts women. When I got involved in Alzheimer's, it was considered a normal part of aging. Now it is not. When I got involved in Alzheimer's, there was a belief that there is nothing that anybody could do. That has now been changed. And when I got involved in Alzheimer's, women were not even in the storyline. So all of these things change by people advocating and pushing and investigating and reporting and not taking the status quo as gospel. And so when I go to these conversations, or when I go around and I see, oh, there's still a portion of people that don't realize this, I just push the message further to make sure as many people as possible know it. And I also try to inspire women to see themselves as reporters of this message. It can't be just up to doctors. It can't just be up to a couple of advocates to advocate for women's health and research nationally or globally. We need more people who can see themselves that way, who can see themselves as sparks in this revolution that we're trying to create.